Undersecretary Gerardo Bayugo and ASEC Abdullah Dumama at lahat po ng mga sumalubong at lahat na nag-a-attend ng summit na ito. Napakahalaga po ng summit na ito na tinutugma nyo ang kahalagahan ng kalusugan at kalikasan. So green health facilities, green health care, that's really what we need to do now, and that's what we should have done actually way back, and that's the way of the future. So despite the fact that we had a late night last night from work in the Senate and other appointments after, and it took quite a drive from Makati where I live here, I saw it a great opportunity to be able to know more about what the Department of Health and our government practitioners are doing to make sure that our health facilities are sustainable, resilient, environment friendly, and how I, as your chairman for the second year of the Committee on Finance, can help you. Mas dalo pong dumami ang mga nag-iimbita sa akin magsalita nung ako naging chairman of finance. Sabi ko, kasi ba gusto nila marinig ang aking tinig o malaman ang aking mga ginawang batas o dahil kaya ako'y chairman of finance kaya dumadami. Wala naman masama doon dahil ilista na po nyo ang inyong pangangailangan. Diretso na ako kausap. Bago ko bastahin yung, siguro wag ko nang basahin tong 15 pages. No, importante. Ilista na nyo para hindi sa huli ng huli yung amendment, hindi ba? Mahirap maghahanap ng pondo pag yan lang yung universe o yung pie. Pero kung sa NEP pa lang, mas madali. Kasi isa po sa aking mga advokasya ay gawin talagang makakalikasan ng ating mga sentro ng kalusugan. So it's important that please, when Sec Pauline comes home, which will be soon because she'll be facing the Commission on Appointments next week, include already the barangay health centers, hospitals, and all your needs for state-owned health facilities, whether it's capital outlay, is MOE, whichever, or increase of personnel, whichever. Please include it already in the NEP and give me a copy of your presentation to DBM because it will go through a long process, as you know, para hindi po ma-chop off pagdating sa amin, para mabantayan natin. Yun, doon ako magsimula sa aking speech and then I will go to my main subject matter. I'm glad that there is this gathering of delegates for the health sector. I see this, as I mentioned, as a great opportunity to build stronger partnerships with you as we seek to create solutions for the growing social, economic, and development challenges caused by environmental degradation and disasters arising from natural hazards, turbocharged or made stronger by climate change. This is an undeniable fact. Anyone who still denies climate change simply does not know what are the most important security challenges of our country and of the world. I would just like to take note that it is so unfortunate that the White House has taken down in its website any issue on climate change. That is truly unfortunate for one of the most powerful nations in the world to take one of the greatest emitters of greenhouse gas emissions to take down its climate change page on the White House website is truly unfortunate. But this will not deter us from working triple time as a vulnerable nation and the third most vulnerable nation in the world with a burgeoning population. One way to perceive how the climate works is to allude to it like the engineering of the human body, complex and interconnected. As you know, the body is an amazing creation made of parts that are integral to making it function. Millions of pathways combine to form cells, tissues, and organs that allow us to be human. It is in the same way that our climate and our planet's environment are interconnected. Changes in climate create impacts that are large and encompassing, affecting every living being, be it human, be it animal, be it biodiversity, flora, and fauna. Climate change, as you know, did not happen overnight. It has taken us super typhoons like Yolanda, and even without a typhoon, as what continues to happen now in Mindanao, in Cagayan de Oro, in Agusan, in Maguindanao, in Caraga region and Region 10. It has caused tsunamis as well, as you know. sinking islands or parts of islands, parched and unusable land as we see in our country, and staggering numbers of displaced lives by the hundreds of thousands, if not millions, and perish to visualize what scientists and environmental activists have been warning us for decades, that among other effects, and I quote, climate change will be the biggest global health threat of the 21st century. As climate change alters rainfall patterns and brings deadly, intensified, and frequent calamities, it will affect public health. Governments, organizations, businesses, the private sector will face conundrums that include the spreading of deadly diseases, viruses, decrease in the well-being of citizens, not to mention medical relief needed with each natural hazard or catastrophe. According to a study conducted by the World Bank, and again I quote, the average global cost of adaptation in the health sector for unequivocal climate change is, let me see, for the prevention and treatment of diarrhea and malaria will reach $1.3 billion to $1.6 billion per year over the years 2010 till 2050. A UNFCCC study estimates that adaptation cost in the health sector will range from $2 billion to $14 billion from 2010 to 2030. We ask ourselves, what has caused this constant warming of the Earth's temperature that has led to this climate crisis? Key findings of the IPCC reveal that climate change indeed is unequivocal, and there is a 95% likelihood that human activity is a cause of climate change. Human activity released, and I can't even fathom this, 545 gigatons. I'm not a scientist. I can't even imagine what gigatons actually means and the magnitude of what gigatons means of carbon dioxide. The main, meron pala akong PowerPoint. Sana naga-PowerPoint? Ayun. Okay, so it's there. The main greenhouse gases from 1750 to 2011. In the last decade, 90% of the rise in carbon dioxide levels was due to the burning of fossil fuels. You know that? Ano ba ang fossil fuels? Gasolina, diesel, bunker, coal. Ay nako, kaya tinanong ko, ano ba tayo? Solar ba tayo dito? Okay. Unless drastic cuts are introduced, global temperatures are projected to increase by 0.3% to 4.8 degrees Celsius by the end of this century. Now, why am I telling you all this? Because you have a great role to play. And we ask now, what is the role of the health sector in the mitigation of climate change? Iba pa yung adaptation. When we say mitigation, of course, that's to lessen the impact. So, the healthcare sector has also contributed, in part, greatly, to the climate crisis. According to Healthcare Without Harm, hospitals use twice as much energy per square foot as a traditional office space, especially since they operate 24 hours a day. That is why it is one of my advocacies to really use renewable energy for hospitals. If only all hospitals could be powered by solar, so that half, first, of the expenses would be cut to half. And second, the sun is free, especially in a tropical country like the Philippines. Why don't we harness it? And the capital investment is very small compared to the savings we get. And if you compute all the needs of hospitals, we would perhaps compare it to power plants that need not be operated because of the savings. So, many healthcare facilities also occupy aging and energy inefficient buildings, and therefore generate tons of waste every day. Whenever we look at something, at a structure, let's see, do we actually need this very cold air conditioner and these very bright lights? Are these lights LED? I hope so. We always think of, we pay for every minute, every second. We pay for everything that we consume, especially in hospitals. We want reliable, efficient, but we don't want to be wasteful. So the World Health Organization has discovered various health risks caused by um, unsafe disposal of health care waste, such as contaminated needles and syringes. The improper and unsafe disposal of contaminated needles and syringes may lead also to dangerous consequences because it could be reused, could be sold, hope not, to be used again, since these materials may be scavenged from waste areas and dump sites. So, from the utilization of renewable energy to the Ecological Solid Waste Management Law, RA 9003, which I authored way back in 2001, on the segregation of waste at source, recycling and composting, and the handling of infectious waste. What is recyclable, what is infectious, what is biodegradable. And I take note, and I'm happy that I see 2 bins in the comfort room here. Actually, kulang pa, dapat 3. Because it's tissue waste and paper and wet carton, and recyclable, bote, lata, plastic, and pinakamahalaga, pangatlo, residual, yung latak. Huwag sinasama yung mga plastic, let's say, na hindi na magagamit sa mga bote, lata, plastic, which are non-biodegradable but recyclable, because you can actually sell them and it goes to an MRF or use them bilang paso sa herbs, sa mga halaman na pwede dito. So, people think recyclable, non-recyclable, biodegradable, non-biodegradable. No. Kami nga ho, Zenet, Catherine, ilan ang ating trash can sa opisina? 4. Ayun. Kulang pa nga yun, minsan 5 pa eh. Kasi OC kami, food waste nakahiwalay. Kasi ang food waste, bagamat tinatapon, ito pa'y binabaon sa lupa at ginagawa ko pong organic fertilizer. I make my own compost. Catherine, totoo o hindi? Di ba? Tayong gumagawa. I make my own compost. Ano ang kasama ng food waste sa compost pit na binabaon ko sa lupa? Ha? Dahon. Okay. Ano pa? Lupa. Lupa, dahon, food waste. O, yung mga balat ng prutas, oo, konting kanin, pero dapat wag magtapon, o ganun, di ba? I make my own fertilizer. At yung hindi na kailangan mag-sweep ng dahon eh, because that biodegrades. In fact, ikumpul-kumpul nyo, tawag doon mulching, sa mga paa ng mga halaman. Yes, and you mulch. Yung malalaki na dahon, ginugupit, or ibabaon nyo, hindi kailangan kinokolekta ng garbage collectors ang dahon at lahat ng galing sa nature, because that's wealth. That's organic fertilizer. It biodegrades on the ground. Kung naguguluhan kayo sa itsura na may leaves, you can mulch it and put it where the plants are, or sa mga katawan ng puno, what do you call it? The bark, the body of the trees. That's what I do. So, I'm sorry? The trunk, correct, in the trunk of the trees. So, you see, everything is useful. At the end of the day, what will be collected by the garbage collector? Just the residual waste. That's why we have to segregate it. If every barangay, every city, every home, because it starts at home, if you segregate the food waste in hospitals, of course, there's no compost pit. Let's find out how we can do that. But if they can segregate it and then donate it to the nearest kung saan may lupa, ibaon sa lupa. That's going to be such fertile ground. And then, bote, lata, plastic can be sold, pang-bonus, pang-Christmas party. Di ba? Pang-tip sa mga endo, sa casuals. Di ba? Ganon eh. Tapos, of course, iba yung pag-handle ng syringes, needles. That's different, the handling of that. But even tissue waste, which we have a lot of in hospitals and health centers, binabaon yan sa lupa. But that is not supposed to go to the compost pit, because a compost pit is for fertilizers, and because of the dye and the chemicals in tissues, then that's not allowed, because a compost pit is for organic fertilizer, which you use for the vegetables. Am I confusing you? Am I just? Okay. So, why am I talking about this? Because this is how we should live. It's so simple. This is how I live. Believe it or not, it's true. So, a waste management assessment of the WHO and UNICEF conducted in 2015 in 24 countries showed that 50% of sampled healthcare facilities had adequate systems in place for the safe disposal of healthcare waste, which means that about 42% of healthcare facilities do not have proper waste disposal methods. So how can the healthcare sector turn these issues and challenges into opportunities for positive action towards climate change adaptation and mitigation? The Healthcare Without Harm and Practice Green Health Toolkit for the healthcare sector aims to increase participation in addressing climate change. Let me just itemize some things from the materials that I secured. What are the opportunities for action? So you see, when I give you a problem, I'm not blaming your sector. I'm going to suggest and recommend solutions based on experts' opinion. Transportation. Healthcare facilities rely heavily on transportation to move patients, workers, supplies, and waste. Hospitals can reorganize the fleets to include high fuel efficiency, hybrid, and alternate fuel ambulances, shuttle vans, and supply transportation vehicles. Energy. Healthcare facilities can make the operations more energy efficient by using LED. Dapat the DOH should converge, collaborate, or put it in your budget. Lahat na retrofit na into LED and energy efficient equipment. Dapat ang air conditioning, inverters na. Dapat ang mga ilaw, LED. Dapat ang facilities, solar na. At dapat lahat may rainwater catchment. I'll get to that. Hospitals that will be built, refurbished, or retrofitted should incorporate green building principles. I mentioned just daylighting. Huwag yung makulog na kwartong kamukha nito. Pero hindi bale, I think this is like an auditorium so that there's good acoustics. So that's fine. But really, to use the natural ventilation, the wind is free. Fresh air, I hope. And the sun is free. So why do we have to use artificial air, which is unhealthy and dirty? Imagine the filters of that. That's so dirty. And expensive light that we are paying for when it's free. If we were in an open veranda, and see the trees outside. So see, we are in Antipolo. We are around mountains and streams, hinulugang taktak. And possibly the view of this, I've not been to this center, I've heard so much about it, the greens. There should have been, whoever constructed this way before, an open veranda where seminars should be conducted. Why are we so scared of grass and of plants and of trees and of bumblebees and ants? No. Dapat ganun, hindi ba? Maybe ako lang ang ganun. Probably think I'm crazy. So, and we should have green roofs. Now, waste management. Best practices in waste management include putting up a material recovery facility, MRF. Again, in my barangay where I was born, Barangay Potrero, Malabon, Google nyo, it won as the best barangay in Metro Manila. In the barangay where I was born in Malabon, there are informal settlers, mahirap na barangay. Pero it was a challenge for me. If my own barangay cannot even implement Republic Act 9003, which I authored in 1998 in my first year in office, and enacted into law in January of 2001, then I would have failed as a legislator. And so I challenged him. In a poor area of Metro Manila, tinuruan ko ang kapitana at lahat ng tao
na maghiwalay ng basura at gamitin ang mga bote, lata, plastic na tamnan ng gulayan. Nanalo sila ng Clean and Green Award sa Metro Manila. Yung isang barangay sa Nyogan sa Tagaytay, kung saan nanggaling ang aking yumaong lola at pinamana sa akin ng maliit na lupa. When I went there a few years ago, tumpok-tumpok ng basura, unhealthy, and the children were walking in the barangay road. I cannot inherit a piece of farm and plant and stay here occasionally kung ganito ang ugali ng mga tao. The Kapitan said, "Naku, Senadora, gustong-gusto namin yung batas mo, mahirap lang." Walang madali. Sino nagsabing madali ang buhay, Kapitan? Ilan ang tao ng barangay mo? Ilang sityo? 7. Akin ang makagawad. Ilang bahay? Binaon ko ang ilang taong nag-training from Mother Earth Foundation of Sonia Mendoza. Lived there for 6 months. House to house. Nag-seminar. Now, it's a model na pinupuntahan ng Calabarzon at meron silang MRF at meron silang gulayan. May alugbati, may arugula, may herbs, may romaine lettuce, libre sa mga tao. I even gave the awards and every sitio masigasig sa kanilang pag-collect ng basura. There are still mistakes. I walk in the barangay road and I see candy wrappers, but they're very conscious. In fact, when I go there, when they know, they anticipate I go there on weekends, ang bulong sa barangay, parating na si Senadora, magligpit na kayo, huwag kayong magtapon. But it should not be a fear of someone. It should be likas sa kalooban. So, is my law unimplementable? If barangays can do it, Barangay Blue Ridge in Quezon City does it. The city of San Fernando is a model city. There are model cities and barangays around the country. In fact, 20% of all our LGUs have done it. Hospitals can do it. I challenge you, you can do it. Best practices in waste management include putting up an MRF, installation of wastewater treatment systems. Some hospitals are using innovative gas capture technology which will capture, reclaim, and purify gases used in operating rooms and will then be reused by the hospital. Is that how it's done? The procedure extends gases life cycle, saving money and reducing greenhouse gas emissions. Now, food service. It has been estimated that 18% of all GHG emissions are associated with meat consumption. And food that come from distant places utilize more energy for transportation and preservation, resulting in greater carbon emission. I've been conscious of that in the past years. Imported ba ang kinakain ko? Bakit kailangan imported? Ibig sabihin yung carbon footprint niyan, malaki. At yung gulay sa grocery pa o sa palengke, kung meron naman akong maliit na lupa sa likod, ay ba't hindi ako magtanim? So I started to plant, and as much as possible, kinakain ko lang po ang gulay na akong nagtanim. Para sigurado ako, organic. Sigurado ako, hindi pesticide at chemical ang fertilizer. Sigurado akong malinis. Yon. So I'm advocating that, and ask my staff, ano ang binabaon ko sa araw-araw at kayo ba ay nababaghingan or do I share it with you? Zenet, ano ang dinadala kong baon sa araw-araw? Ha? Anong klaseng mga gulay? Saluyot? O ano pa? Katrin, lechugas, galing saan? Sa farm. Okay, sino nagtatanim? No, tayo. Okay. I share it with them. Inuubos ko ba o kayo rin kumakain? Okay. Sige. I share it with them. Turn by turn kayo, di ba? Mga 2 or 3. Oo, ganon. So, as much as possible, I don't buy imported clothes. Yes. Even this is made by the PTRI, Philippine Textile Research of the DOST. Lahat lokal. Sapatos ko, lokal, Marikina, lahat gusto ko gawa sa atin. Pati pagkain, yung malapit lang binili. Sana backyard. Kung hindi kaya, sige. May iba minsan siguro imported ang kinakain, pero hindi kailangan eh. Ang sarap-sarap ng ating mga bagong pitas eh. Mas masarap pa yun eh. O lugbati, ang bilis mag-grow, di ba? O kangkong, ang sarap-sarap, ang dali-dali. So, what I'm saying, wag naman baka naman sabihin nyo pagkatapos ito, si Loren Legarda naman, sabi, kain namin talbos ng kamote at saka kangkong lang. At, ibig ko lang sabihin, we can really reduce our expenses and live a more healthy lifestyle by simplification and unlearn kung anong kinalakihan natin, minsan mga limali o nakikita sa consumerist society that we live in. So, hospitals can also lessen our GHG emissions by reducing the amount of meat, protein on their menus. Nag-serve pa ba ng mga meat sa ospital and pork? Dapat hindi. Diba? Dapat fish at saka gulay. At dapat sinasabi, in fact, dapat organic sa lahat ng ospital. Hindi ba? Dapat organically grown local vegetables and fish. Why do we need to serve pork? In fact, we should ban pork and meat. And chicken should be organic. Why would you want to eat chicken that's been injected with antibiotics? No. So I don't even eat chicken, except when we're on the road, I have to eat fast food, of course. Pero pag chicken, pag bibili ako, it has to be organic. In fact, I intend to grow my own chicken so that alam kong anong kinain at ano ang klase. Really. So, buy local in terms of food, yes. Organic and in-season food, composting food waste, as I mentioned, and what is my water? Eliminating bottled water. It's very bad to have bottled water. Ay, nako. Imagine, we have to drink 8 to 10 glasses of water a day. How many are we? 100 million Filipinos. Lahat mag-bottled water, tsaka mahal-mahal, di ba? Ako hindi, I have a jug, and then I just bring my own water. Because every bottle, where will it go? In fact, manufacturers and producers, dapat yan may responsibility. You produce something, and you are responsible to biodegrade it. You should be responsible. Paano mauubos yan? Paano babalik yan sa zero? You produce it. You don't produce it, bahala na ang waste. No, produce it, and then kailangan it should go its full cycle. So, addressing the climate crisis clearly needs a whole of society approach. The health practitioners, the lawmakers, government leaders, our workers in the grassroots, everyone. We need the government to lead, but we can't do it alone. All the laws that I've authored in my 3 terms from 1998, from the Clean Air Act, the Clean Water Act, the Ecological Solid Waste Management Law, the Renewable Energy Law, the National Disaster Risk Reduction Management Act, the Climate Change Act, the People Survival Fund, even the health laws that I authored, including the creation of the Hearing Institute, the newborn hearing screening, and many more. All of these laws would be ink on paper if agencies of government and even the public and the private sector do not help us implement these laws. We need government to lead, but other sectors of society, including the healthcare sector, must give their wholehearted, passionate commitment to take action as well. In the Senate, we continue to improve legislation and practice our oversight functions to ensure the implementation of our laws. We have the necessary laws in place. I mentioned not all, ang dami-dami kong nagawa muna 98, but those are what I can remember in the environment and health sector towards building a healthy, resilient, sustainable, and climate-adaptive nation. Nabanggit ko ba yung Clean Air Act? Yes. It's not being implemented to the standards that I wish. In fact, there should be clear working monitors in every urban city. I don't think it's working. The Clean Water Act is very poorly implemented. The Pasig River is like the Pozo Negro ng Metro Manila. And we will have a water summit soon with various agencies of government. I will make sure that the DOH is part of that water summit. The solid waste management law, I've told you about it, only 20% compliance, but the RE Act, it's new, but you can see a resurgence of the use of wind and solar power, hydro, of course. The disaster risk reduction, it's being done. There are DRR officers in every local government. The Climate Change Act, very new, created the Commission on Climate Change. The People Survival Fund, it's a 1 billion fund where local governments, people's organizations can give proposals to the PSF of the Climate Change Commission and the Department of Finance so they can access funds for climate adaptation and mitigation. So what is important is we take proactive, urgent, and continuous action. So I also commend at this point the Department of Health for organizing this event and for releasing a manual on safe hospitals in emergencies and disasters. It is important indeed that our hospitals are resilient and that medical practitioners and hospital personnel are knowledgeable and competent, especially in times of disasters. Hospitals are critical infrastructure as these facilities house the most vulnerable people, sick, the elderly, our children. We must make our hospitals and medical facilities not only green and sustainable, but also safe and disaster resilient. This is in line with the commitment to the Safe Hospitals campaign of the UNISDR, which was launched a few years ago. It is also important that all our health facilities, from the smallest unit of the barangay health centers, before even a site is selected, hopefully a geohazard is done. And in fact, a multi-hazard risk assessment so that it will not be the first to collapse or the first to be affected during a natural hazard, including an earthquake. It is likewise important that doctors, nurses, hospital personnel know what to do in times of disasters. In fact, there should be regular fire and earthquake drills in hospitals to include practice and instructions concerning the location, the use, and the operation of emergency kits, fire escapes, doors, and fire extinguishers, and other emergency kits and facilities. What do you call the kit in my car? The go bag? Is it the go bag? Is it in my car? Are you sure? Meron? I always have a go bag. Basic. Baka wala. Lino. Diba? Meron? Driver. Go bag. Okay. Kompleto. Anong laman ng go bag? Alala nyo, hindi. Nag-seminar tayo doon. Anong laman? Mga gamot, ano pa? Flashlight. Yung mga basic. Anong kailangan? Meron pang underwear, di ba? Basic things. So, go bag. Nag-seminar pa kami gano'n eh. OC masyadong opisina ko. Sige. So, my point is, why am I overdoing this? Hindi pa nga overdoing to. Every day I lecture them. Because we must develop a culture of safety, of preparedness, of resilience, especially in these crucial times when extreme weather events are the new norm. And so, this summit is so important. I would request that the output, whatever paper, resolution, studies that would come out of this seminar today and tomorrow, yes, just one day, could you kindly share it with your committee of finance and climate change? I will share it with the health committee so that it could be part not just of a privileged speech, of legislation. This is very important research. All your inputs, you're the experts, we're the policymakers. Pause na. In closing, I wish to stress that we live in only one planet. And by now, climate change should make us realize that we are all connected and we suffer the same consequences of this crisis together. Each of us has the opportunity for our future. We must take hold of that opportunity responsibly and manage our environment. Let us make our Earth a sustainable, safe, healthy planet for all of us and the future generations. And let it be said that during our watch, as leaders and policymakers and as stewards of the future and of the earth that will be inherited by the future generation of our children and our children's children, that they used and wielded our power, our resources, our time to make our environment and our earth safe, resilient, and healthy. Thank you very much. Magandang umaga sa inyo.